So during an appointment, if it's your first appointment or even if it's your 51st appointment, we always are going to do an evaluation with you. We want to see what your goals are, what's moving, what is bothering you, if there is anything that's bothering you. We do not take a kind of cookie cutter approach here at Serendipity. We tailor each one of our consultations to what the patient needs at that time. And so we're going to talk about it. And so you'll make all these kind of funny movements. We're going to ask you to lift your eyebrows up. We're going to ask you to frown. We're going to ask you to smile real big so that we can see everything that's happening at your face. And then we're going to have you tell us what's bothering you and what you'd like to focus on. After that, we at Serendipity pride ourselves in trying to keep you as comfortable as possible, so we will apply a topical numbing agent. Usually it's a combination of benzocaine, tetracaine, and lidocaine, and it is just a little cream that we put on there. We let you numb for anywhere between 15 to 25 minutes. And once you're nice and numb, we're going to clean everything up, make sure that we're going to prevent infection, and then we're going to go ahead and go with the injections of the toxin. Toxin itself really is virtually painless. It can feel like a small mosquito bite or a small ant bite. Sometimes there's a little residual whelp like you can get after an ant bite, but that usually resolves within about 20 minutes. And sometimes there's a little bit of bleeding, hopefully not too much, but anytime a needle touches the skin, you always have to be prepared for a little bit of that. Afterwards, you potentially could have a little bit of bruising as well, but it's not very often that you bruise too bad.
There's also preventative measures that you can take to avoid some of the bleeding and bruising. If you're already prone, then, that's one thing, but avoiding taking your aspirin about 2 days before, not consuming caffeine the day of your appointment, because all those things kind of thin the blood and get things moving a little bit more. So if you're prone to bruising, then just keep that in mind as kind of a pre-care instruction.
Arnica also can help too.
Yes, and we do send our clients home with arnica on the skin to prevent as well, because we want you to have the most comfortable experience and not experience really any side effects. Does getting toxin injections hurt? So from personal experience and from a lot of client feedback that we've got, it's not a uncomfortable experience for the most part. Anytime you get a needle poke, there's always going to be a little bit of anxiety there, but we do our best to avoid that. We topically numb the skin. We have nerve distractors, those little devices that we can place to keep your mind off of it. But what you can expect in terms of sensation is similar to an ant bite. Stings for just a second and then it's over, and then you look younger, and that's always great.